Yeah, State Health Officer Dr. Thomas Dobbs says about 80 to 90% of the COVID cases we're seeing in Mississippi are from the Delta variant, and majority of the cases are in people that are not vaccinated. Mississippi ranks dead last when it comes to vaccine shots in arms. 95% of hospitalized cases and a quarter of Mississippians 65 and older are not vaccinated.
That's a very worrisome number.
State Health Officer Dr. Thomas Dobbs says the rise in cases comes from a very contagious Delta variant, which was reported to be here about 2 weeks ago.
It has some mutations in the spike protein that give it a greater binding affinity. So it's easier to sort of like grab on to your receptors in your nose and in your respiratory system.
Outbreaks among youth is a big part of the rise.
So we're seeing a lot of transmission within like summer activities, band camp, cheerleading camp, VBS, summer school, which really makes us really worried about going into school in the fall, right?
His message to defeat this variant is a repetitive statement: get vaccinated, and locals agree.
Hey, see how many people it done killed already, the coronavirus. So, you know, I don't know why they don't want to take the shot.
It'd be better for everybody to be vaccinated because we can get back to living like we once was living before.
Dr. Dobbs called COVID-related deaths unnecessary tragedies.
Sincerely, if all of Mississippi got vaccinated for COVID, everybody who's eligible, I don't think that we would see hardly another death from COVID.
And so far, the State Department of Health is reporting 137 Delta variant cases. And if you're vaccinated and contract COVID-19, Dobbs says contact your doctor and ask about the monoclonal antibodies treatment, which can reduce hospitalizations by 75 to 90%. For 12 News, I'm Gary Burton Jr. Back to you, Mel.